I'd like to, again, my name is Karen Johnson, the Director of the Alzheimer Outreach Services, and I'm providing this presentation on behalf of the Year of the Brain 2015. I would like to make a disclaimer that I'm not a registered horticultural therapist. However, I am a trained horticulturist and a registered social worker. I spent almost 3 years working in a long-term care home as a therapeutic gardening instructor, providing therapeutic horticultural activities for residents. And to be quite frank, this is an area of passion of mine, and it is a privilege to be able to share my knowledge and experience on this topic. That said, I wish to promote the value of trained and registered horticultural therapists, and my intention is to educate the general and professional public on the incredible work that can be done through horticulturally based activities. This is one of my favorite quotes, one I discovered several years ago, and I really believe it to be true. It doesn't matter what age, what gender, where someone is from, or what one's condition is. When I read this, I think of one of the residents I worked with in a long-term care home. She had Lou Gehrig's disease and had been an extremely avid gardener. Her garden had been vital to her, and living in a long-term care home with her physical abilities fading, she had had to give up her home and all of her plants. One of her favorite activities with me would be breaking up the clumps of soil mix with her bare hands, which we would then use in future sessions when planting seeds. It exercised her hands, and the smell of the peat moss brought her emotionally back to times that brought her pleasure and comfort. Times when she would be planting seeds or transplanting seedlings in her home. She loved the texture of the soil, her ability to exercise her weakening hands, the opportunity to reminisce, and the time to emotionally process the changes she was experiencing. Now, I already digress, but I anticipate providing you a presentation that would be filled with information and examples which will hopefully encourage others to take up the cause of horticultural therapy work on, or in the least, to take up maybe a little bit of gardening. So our agenda for today, I'll talk about what exactly is horticultural therapy. Not everybody knows it. Where did horticultural therapy come from? So we'll discuss the history. Why do we want to use horticultural therapy? We'll also look at some research in AOS's Adult Day program as we wrapped up a research project with Fanshawe College, so I'll just talk about that a little bit. We'll talk about the purpose of horticultural therapy, how we can use it, how we can use horticultural therapy-based activities, talk about the environment, tools, and then I'll also provide some practice examples from my own background in work. So broadly, the Canadian Horticultural Therapy Association states that horticultural therapy and therapeutic horticulture uses plants, gardens, and the natural landscape to improve cognitive, physical, social, emotional, and spiritual well-being. Well, horticultural therapy is still a relatively new discipline that's still gaining foothold in Canada. It is a truly holistic range of activities that involve all aspects of our senses through a variety of modalities for rehabilitation and therapy. Sight, smell, sound, and touch, so often understated yet so incredibly powerful. And it really affects individuals of all ages, roles, and a variety of health conditions. Even for individuals who do not realize or would think that plants affect them subconsciously, they may feel the effects of plants even in their environment. So these plants, they can be tiny, but they're certainly mighty. The therapeutic benefits of horticulture have been around actually for a very, very long time. In 500 BC, the Persians recognized the value of sight, smell, and sound of gardens. They developed waterways that created a texture of sound and sustained fragrant gardens whilst providing cooler environments for the population. If we zip ahead to the 19th century, where Dr. Benjamin Rush, who was a psychiatrist, he fostered the idea of garden settings providing a curative effect on patients with mental illness. He published research stating that digging in the garden was a distinguishing factor between men who recovered from their mania versus men who did not. So he saw that the activity was quite therapeutic. Thus, the hospital grounds became manicured with walking paths. If we think about this time locally in London, Ontario, the grounds of the old London Psychiatric Hospital followed this route of therapy for patients, including a tree-lined road up to the facility with manicured lawns, shrubs, and paths, all courtesy of patients. In the 20th century, horticultural therapy took a large step forward as it was used in the treatment of veterans after World War I, as activities were used in occupational therapy and psychiatric therapies. In 1972, horticultural therapy was developed by the Menninger Foundation in conjunction with the Horticulture Department at Kansas State University to provide the very first undergrad program in the mental health field that would lead to horticultural therapy as a mode of therapy. Currently in Canada, we have the Canadian Horticultural Therapy Association, which was established in 1987. It promotes the awareness and use of horticulture-based activities as a mode of therapy. To become a registered horticultural therapist in Canada, one must follow through with the process which the CHTA has designated. We find in practice therapeutic gardening activities occurring across the country in long-term care homes, adult day programs, addiction treatment centers, mental health facilities, and children's centers, only to name a few areas. Why do we use horticultural therapy? And what does research have to say? Well, research is still growing in this area. Therapeutic gardening has shown benefit, particularly for individuals who are elderly, by providing an outlet for exercise, improving stamina, and promoting sleep, which is a benefit for individuals whose circadian rhythms have become disrupted. Gardening has also shown benefits for cognitive enhancement. It increases sensory stimulation. Think again of the various senses engaged with gardening activities, that's sight, smell, sound, and touch. Individuals with dementia in a secure home environment, such as in a long-term care home, have shown to exhibit less agitation when allowed free access to an outdoor garden space. It's suggested that having the freedom, the choice, to enter such areas was beneficial. This should really be a monitored intervention, however, as the garden space needs to be free of toxic plants and also have environmental adaptations for limited mobility. And it should also be secure. Falls are a high risk for individuals living with dementia, and the focus in long-term care homes is to encourage residents to maintain or improve physical abilities. Some studies have shown that providing a garden space, such as a wander garden, for individuals to walk at will helps to maintain physical ability and possibly reduces the use of medications as restraints. This is an area that still needs further investigation. Interestingly, the use of a natural environment for treating pain has been investigated with positive effects. Studies have shown less pain and quicker recovery time for individuals post-op who had a window overlooking a natural outdoor environment versus individuals who only had the view of a wall, say a brick wall. Patients experiencing true sunlight in their rooms utilized fewer analgesic medications, thus incurring less cost on the health system. Individuals struggling with attention deficits secondary to other conditions such as head trauma, pain, post-stroke recovery, depression, or anxiety have shown improvement through the use of horticultural activities. And this is under the hypothesis of attention restoration theory, which in a nutshell is an individual's ability to filter multiple extraneous stimulations as they attempt to focus on a particular task or activity. In horticulture-based activities, such as being outside in a garden, say someone's going for a walk, the individual uses involuntary attention, which doesn't result in the same level of fatigue that results from voluntary attention. So this involuntary attention is roused by observing various colors, textures, contrasts, and the various happenings in a garden setting. So basically, the theory is that it allows the mind a longer span of attention to focus on the garden setting, which uses less stress and energy compared to a more sterile clinical setting, such as an indoor room. For individuals with an acquired brain injury, it has actually shown attention gains for them. Something as simple as the outdoor activity of walking in areas of nature has shown a positive response in attention improvement. Stress. Perhaps one of the banes of our modern society, it is even affected through the use of exposure to gardening or garden activities. Through the actual activity of gardening or passively observing it, stress has been noted to decline. Give up the TV, folks. One study noted that individuals on a treadmill who observed pictures of pleasant rural scenes experienced a greater drop in blood pressure versus subjects viewing unpleasant urban scenes. Even donating blood, individuals who watch nature scenes on television, on television, they experience less stress measured through blood pressure and pulse rate compared to those watching regular television or no television at all. It has been shown to even affect EEG activity. This is huge. So the moral of the story, the next time you're at the doctor, perhaps opt to watch that home and garden television station instead of Maury Povich. Lastly, regarding stress, another study showed benefits in reducing stress levels with a walk in a rural setting versus an urban setting. So in summary, multiple studies beyond what I've mentioned support the belief that interacting with nature lowers cortisol levels and improves stress. Lastly, on this page, one particular study on individuals with early onset dementia participating for a year in a guided activity horticulture program showed maintenance or actually improved well-being despite experiencing cognitive deterioration. At AOS, as I mentioned, we had a collaboration with researchers from Fanshawe College, and they investigated engagement and enjoyment of gardening activities compared to music programming and gaming activities for some of our day program clients. This was last summer. And in summary, the sample of day program participants in the garden programming showed remarkably higher scores of well-being and engagement versus music and gaming programs. It doesn't mean that the music and gaming programs aren't as relevant, but it certainly for us leads us in the direction of maybe investigating what we can do to increase the engagement and enjoyment for those participants. Back to our horticultural study though, participants, they did not exhibit significant differences between the levels of well-being or engagement whether activities were structured, so meaning if they were led by a member of the care team, if a recreation staff member was out guiding them, or unstructured, so meaning that they could actually participate in the activity without direct influence from a staff member. And a really pertinent theme which came from the data was the importance and enhancement of teamwork amongst participants engaged with gardening. This is really exciting. A number of participants, each who cared for their own specific plots, would water the plants or remove weeds from the plots of other participants who were not able to attend on the specific day. And during the program, participants were also observed to be working together to achieve certain goals. So we have these gardeners who are super social, and they care about each other, and they care about their garden plots. Reminiscence was very high for participants while they were participating in the garden programming. They chat with each other and staff about their occupations, their experiences working in the garden before, birds that used to eat in their gardens at home, etc. And what's incredible, in almost every occasion of reminiscence, it was associated with extremely high levels of well-being. According to caregivers at home, the participants frequently and spontaneously talked about his or her garden club experience while here at AOS on the day that they participated, and also on days other than when they were in the garden. And that is really significant for people who have dementia who may be experiencing memory issues. When asked about their emotional expression, family caregivers often stated they were very happy and enthusiastic. And families also noted that the participants spoke about their gardens with pride and a sense of personal accomplishment. Times of upset were often related to an undesirable or unexpected event which occurred, such as something like a flower in their personal plot wilted or died, or caterpillars ran rampant. There were some risks and barriers noted from this study. There were a few near misses in relation to falls, light sunburn, potential dehydration, consumption of non-ripened food from a sensory pot, feeling too warm even when sitting in the shade, and fatigue through overstimulation. We've looked at the results of engaging in horticulture-based activities. Thus, let's dig a little deeper into the purpose and how do we make the magic happen? Well, sensory stimulation is huge. Its effects are global, affecting everyone at various stages, various ages. So for a moment, I want you to imagine smelling a rose, or your hand after you've touched a tomato plant, if you've done that, or perhaps maybe the scent after deadheading a marigold flower. Where did you just go? So many of our memories and experiences are linked to our olfactory system. I like to describe for people one of my strongest positive memories attached to a smell from plants. When I smell fresh sage, I'm instantly taken back in time to my grandparents' farm, where in my mind I re-experience peacefully walking on a gravel road in the dry summer sun, listening to grasshoppers and smelling wild sage in the ditches. As another example, anytime I visit a greenhouse, I can literally feel my body relax and my breathing instantly changes. As soon as I smell the peat moss in the plants, feel the unique humidity and the heat of the greenhouse, it's all related to my past, which happened with an avid gardener grandmother who instilled the love of gardening in me. These are examples of the power of sensory stimulation through the use of plants or gardening materials. These are some of the pots that I used in my role providing therapeutic gardening activities at a long-term care home. We use similar modes in the AOS Day program, the Feel Me and Smell Me plants. There are a number of plants that are really great for touch. Ideally, if you wish to create something planned like a planter, use plants that are non-toxic and safe to touch and eat. I personally love the feel of the plants lamb's ear, silver mound, blue fescue, and sedum. So really a wide variety of textures. For scent that doesn't include thorns, I recommend scented geraniums. They're a really great option. And herbs also work wonderfully well in smell me planters or even taste me planters. If you're using plants for the older adult crowd, it's important to use plants that are the old favorites or are more common. I know, for the hardcore plant nerds like myself, I just heard balloons deflating. No, you really should refrain if possible from using the new black flowering petunia cultivars. Use the old standards that everyone knows, things like geraniums, petunias, marigolds, alyssum, those kinds of things. Use the, sensory plants that are used to calm. They're used to calm, they can stimulate. They're also used to elicit conversations and even pull out memories. I remember once working with a woman who had a quite advanced Alzheimer's disease, and she was barely able to speak. And one day I put an ornamental gourd in her hands, and she played with it, and she rolled it in her hands. And for almost a minute, she was actually able to tell me what she remembered. And she remembered Bayfield and having these things. She couldn't really name it, but she knew it. So it really tapped into something. And how incredible is that? It's a gift, an absolute gift to bring that moment to someone for that brief period of time. The purpose of horticultural therapy stems beyond sensory stimulation. It includes exercise. Tons of exercise. We exercise our eyes through visual scanning, seeing near and far, and it also improves spatial relationships. Provides practice in that eye-hand coordination, helps us to learn to see differences in size, colors, shapes, and textures. We exercise our hands, fingers, arms, and upper and lower body. It gets us to stoop, bend, reach, and keep our balance. We get mild to moderate exercise and coordination, strength, stamina, and endurance. I don't know how many of you end up with a sore back if you've gone out and done a spring cleanup or done some raking in the fall. I know I do. It's definitely physical activity. We also get enormous pleasure through our senses. Again, that seeing, smelling, feeling, and tasting. Sometimes we're dependent on adaptive equipment, which is what I'm going to talk about shortly. It provides pleasurable physical activity to those with physical disabilities or sensory impairments who wish to enjoy gardening in a home setting. Emotionally, it increases our self-esteem and self-confidence, satisfies some of our needs to be nurturing and caring, provides opportunities to be creative and imaginative. It gives us also a sense of responsibility, which I'm going to describe in a couple of my examples. It provides an activity that also wins the respect, approval, and admiration of others, and I think that reinforces what we experienced in our day program last summer with our study. It provides opportunities to anticipate future events and develops patience. If you're not a very patient person, this will test your patience, watching things grow. Intellectually, it teaches us new skills and techniques in horticulture. It increases our interest in gardening, gives us a greater awareness of living things around us, exercises our minds in terms of memory and logic, and it gives us practice in following directions. And it definitely, exercises our attention span, which is what the research has shown. It improves social skills, self-esteem, and confidence. Promotes interaction by providing a common interest to discuss. What a wonderful thing to talk about when you go into someone's home and you see plants in the window. It's an instant connection. Gives us practice in expressing our opinions, formulating descriptions, asking questions, and exploring definitely our sense of humor. And it gives us a topic about which we can be relaxed, informal, interested, and even challenged all at the same time. It gives us a chance to relate to one another on an equal level, perhaps as one gardener to another, and helps us learn good work attitudes and behavior. And for some folks, it gives them a chance to practice leadership and to become comfortable with teaching others. So how to use horticultural therapy-based activities? I'm going to ask you that. Just think about this. What do you envision therapeutic gardening activities to be? Who can do it? Where can you do it? Gardening does not start and end in the garden. Sometimes it starts with a garden catalog in early winter and ends with fall cleanup. Activities can be indoors or outdoors. As long as materials are safe, any person can participate in horticulture-based activities. They need not constitute the actual growing of the plants. Perhaps it's just use of parts of the plants for various crafts or activities. And one of the main things to keep in mind for anyone who is doing a horticultural activity, please keep in mind that the finished product doesn't have to be perfect. Gardening it's not a perfect art. The activity is a journey, and it's the process of getting there that is the most important. Horticulture is a beautiful thing because the sky is literally the limit for ideas. Actual plants, feed for birds, trees, cut flowers, fruits and vegetables, anything to do with nature is at your disposal to use in horticultural activities. It is not and should not be considered a spring to fall activity. The seasons offer multitudes of opportunities to provide horticulture-based activities. Think of the scents, the smells that belong to each season. Those can be incorporated into activities and crafts. Nature is a beautiful palette and a means of creating art, utilizing different natural items to create art pieces. And don't forget that there is a story behind every plant, or that months or significant holidays have some kind of plant meaning usually attached to them. Exercise the brain through plant trivia and knowledge. Some of the most interesting pieces of knowledge about plants I actually learned from my clients. Those golden nuggets of information passed from one gardener to another. And the internet is also a great source of information, I have to admit that. One particular study I reviewed looked at horticultural therapy activity training for staff in long-term care homes, as it's been noticed that often facilities develop gardens that may not A, have the participants in mind. So things, they plant toxic plants in the landscape which can be inadvertently eaten, or B, they have physical designs which restrict the access to garden areas or activities for residents. This study highlighted the value and importance of the facility investing by training recreation staff in the use of horticultural activities and expanding their plant knowledge if the benefits of an active garden is to be developed and maintained for residents. A sample of some of my favorites, favorite non-gardening outside activities, as I do a lot of gardening outside, but there's also a lot you can do inside. So here's some examples. Pressed flower bookmarks, easy to make with much versatility. What a lovely process, which starts with the client choosing the flowers, picking them, putting them in a press, and later rediscovering them dried and flat. Let the artist appear and voila. Another idea along this line is flower pounding, where you pound different flowers against some cotton material, and the colors from the flower transfer to the material. These can be used to create a variety of items, again, bookmarks, maybe parts of ornaments, and even placed in a picture frame. It's really pretty to do, and you can try all kinds of different flowers. It gets exciting. Another item, ornaments with leaf prints. Again, allow the individual a choice of leaf and press into a simple flat piece of clay that's been rolled out, and use your roller to press the leaf into the clay. Allow it to dry and then finish with paints or leave natural and seal. They can be necklace pendants or tree ornaments, you name it. A much larger version can be created using cement with larger leaves, and this is a bit more of a complex process, as you need to pour the cement on the item you wish to have, leave the imprint, and let it dry. You may have actually seen this type of item used as bird baths or stepping stones. When winter seems endless and spring far away, forcing early spring flowering branches into blossom can bring some horticultural relief. Forsythia is an easy plant to force with its bright, sunny yellow flowers. I've also done magnolias, but I admit the water in the vase with magnolias develops a particular odor that leaves much to be desired. So take your chance with that one. I do recommend forsythia or pussy willow branches. This is particularly fun to do if the person you're doing this activity with is able to walk and participate in the choosing and cutting of the branches. Forcing bulbs is another great activity in the winter. In this photo, you will see paper whites, a small, very forgiving bulb, placed in a container with water and perhaps some stones for balance, and voila! There are also a variety of shapes of clear vases specifically meant for forcing bulbs. Lastly, I always like to incorporate insects into horticultural programming, as plants and insects are really codependent. Butterfly projects are almost a magical thing to children and adults alike. Who in the world isn't fascinated to observe a caterpillar cocooning or a butterfly hatching from its metamorphosis? There's a lot of education and cognitive discussion attached to projects such as these. When providing horticultural activities indoors, it should be safe and flexible. Again, non-toxic plants, and keep in mind anything might be accidentally ingested, including dirt. Grow lights need to be kept someplace where they cannot be accidentally tampered with. For an institutional setting, I recommend a horticulture cart for mobility. It should have something like the tidy tray, which is shown in that bottom right-hand corner. This is a really great tool to use at the bedside or at the table. It's really easy to transport. I recommend with the cart, have the horticulture basics. It's basically your invaluable travel kit. Always have garden magazines, catalogs, and nature-based items to elicit conversation. Encourage plants to grow on window ledges if safe and appropriate. You'd be surprised to discover the number of individuals who suddenly take an interest in maintaining the plants. And refrain from maintaining any indoor plant projects you have going. I'm going to quickly interject with a quick story here. I had a resident that I worked with, and she had 2 green thumbs, and I used to joke with her that I could kill indoor plants, which isn't far from the truth. I'm more of an outdoor plant person myself. However, she really thought I was bad at maintaining indoor plants, because in the little greenhouse that we had, the plants always looked neglected. Well, I did that deliberately because I wanted some yellowing leaves. I wanted plants that the residents could maintain for themselves, and using fine motor skills and talking about it, and just lots you can do. So when you have plants, if you are a perfectionist and you're a gardener, and a lot of them are, you really have to refrain from doing all that cleanup, because those are beautiful activities for residents or individuals to do themselves, is to clean up the plants. So yeah, so this resident thought I was absolutely horrible with plants. I'm sure she wondered how I got the job. The outdoor environment. Despite the glory of experiencing sunshine, wind, and all that the outdoors provides, there are a fair number of risks to keep in mind. The temperature, the amount of sun, the glare from cement pathways, tripping hazards with lawns or the steps off and on lawn areas. And that said, but being outside is still a wonderful thing. It is really the ultimate for sensory stimulation. The sound of wind in the trees, birds singing, maybe hearing a lawn being cut, the smell of flowers or cut grass, observing the colors of flowers, the sky, and feeling the wind or sun on one's skin. These are things we often take for granted as helpers. Imagine how that must feel for people who do not have the same liberties or abilities. Gardens really should be a place that attracts some level of fascination, so there should be interest points and lots of colors and textures. Outside, there must be areas that allow for rest, such as benches, and definitely areas that provide shade and shelter. A water feature is highly recommended. The sound of trickling water can be quite relaxing. Raised beds are a wonderful way to garden, as they reduce the need to stoop and are easier for individuals who may need to be seated, perhaps in a wheelchair or on a bench. Always, I can't stress this enough, always ensure the plants in the area are non-toxic. It's really surprising, a lot of common landscaping plants are actually poisonous. For example, yews, Y-E-W-S, are a very common shrub that's used in landscaping everywhere, in people's yards, on institutional settings, you name it, but they're actually extremely toxic. and even the seeds of morning glory flowers. They actually contain compounds that, if ingested in large quantities, can produce LSD effects. So there are multiple resources online that can provide lists of what is toxic and what is non-toxic. Tools may need to be adaptive. So there are a number of tools available to use in horticultural activities, and it really depends on who's using them. Personally, I've always enjoyed using the ergonomic tools, as shown in the top left, for both actually myself and clients. Seeding tools can help with planting so that seeds don't all get planted in one big bunch. There's a seeding assistive device actually on the top right there. Seeding tools, so also various watering devices. For individuals who have a poor grasp or maybe a weaker grip, consider providing them a wet sponge. And if you give that to them to hold and they can squeeze it gently, that gives them the opportunity to still be able to water a plant. For individuals with tremors but still good strength, consider using a weighted hand tool with a broader grip, similar to weighted utensils that they might be using when they're eating meals. That may actually be beneficial. Do not hesitate to utilize telescopic pole tools when working out in the garden to reduce stooping and provide range for individuals who may be in wheelchairs. Always have the basics on hand, and if you do not have physical limitations yourself, please try to put yourself in the other person's shoes. I discovered this when trying to find even a suitable garden shed that would be accessible to individuals who utilized wheelchairs. Look at how the doors open and how they can be closed and the items inside accessed. So just as an example, we purchased a shed actually similar to this one, and because sometimes I knew volunteers and residents in wheelchairs would be coming in and maintaining their gardens on weekends when hopefully I wasn't going to be there when it wasn't my shift. So what I discovered is the front doors opened great, but people in wheelchair couldn't pull the top back down once the top had been popped up. So we had to attach sort of like a like a type of rope that was attached to the inside of the top that the person in the wheelchair was actually able to reach over, grab, and pull down the top. So again, it's that think about accessibility from outside of your own personal lens. I'm going to give you a few practice examples of mine. As I mentioned earlier, I'm quite passionate about insects as well as plants, and particularly with butterflies. So we purchased, I had an aquarium donated to me to the program, and it was a really beautiful aquarium. We had a top put on that was all mesh, and I ordered some painted lady butterflies. So that's actually what you see on the screen there. Painted lady butterfly larvae. So we received about 25 of these little tiny caterpillars in the mail. And I had a resident who had MS, but she still had she actually had really good fine motor skills. And so she separated all the insects into little individual containers, and there was food for them. And we were able to watch the butterfly, the caterpillars grow. And unfortunately, something happened during shipment for poor caterpillars because they were dying off. So we had the aquarium set up in the center of this long-term care home, and it was very visible. So volunteers, staff, residents, everyone passed by this aquarium that had these caterpillars. And eventually we came down to having only one caterpillar left. And it went into a cocoon. And that was extremely exciting. And for the summer, it was really interesting because everybody was reporting to everybody about the butterfly project and how this caterpillar was doing. And we ended up, it went into cocoon, and then it hatched, and we actually ended up with our very first butterfly. It was very exciting. We held a contest to name the butterfly, and the butterfly was named Freedom, and Freedom was released outside, and it was absolutely incredible. But I guess what I'm trying to say is there was a sense of community that happened through a butterfly project. Everybody was talking about this. Everybody was engaged, and had everybody seen Freedom. So it was really quite magical. I'd like to talk about Ms. G. Ms. G, she was the master vermicomposter. For people who don't know, you can actually purchase a bin and put soil in it and items and little red wiggler worms, and it's called a vermicomposter. So it's great for composting kitchen scraps. People have these little bins in their kitchen or their basement, and it's just in case if someone doesn't have a composter outside. So at our facility we had a vermicompost bin, and I had Miss G, who again, this woman actually had MS as well, and her job was to feed the worms. So she made a point of, from her scraps, from vegetables or fruit, from treats, or excuse me, snacks that she had, and sometimes she would actually make a point of getting eggshells, which was really important. It became her job to take care of these worms, these red wigglers that were in this bin. And so she made a point of a couple times during the week coming down, checking them, adding some of the scraps in there, adding shredded newspaper. She kept close tabs on those worms, and it brought her meaning, and it made her really happy, and she was very happy to report to people how the worms were doing. When we ended up with a fair amount of soil or worm castings in the bin, we dumped the soil onto a table that was covered with plastic, and we were able to separate the worms together, separate them from the dirt, and then use the dirt in some of our other planting activities. But if you think about it, so she was engaged meaningfully and emotionally, cognitively, and then physically as well, because she was sorting through the items, and we talked, and it was a very therapeutic activity for her. She was very, very proud of her job, her role. Mrs. W, she was a resident living in the home, and she was already in the horticulture program when I was there, and we would work on a number of projects, and unfortunately her husband passed away. So a part of my work with her really focused on talking about him and processing the grief. And one of the biggest activities that we did, and was really helpful for her, we took flowers from her husband's funeral wreaths, from his funeral flowers, and we actually pressed them and we dried them. And then she would choose the flowers, and she did a couple sort of pictures with them, things, and made some cards, gave them to some significant people. But I think the most important thing she did, and I know she really saved the best flowers for this, was a picture frame similar to this one. So the dried flowers the pressed flowers were put on the mat for the picture frame, and then she had, as the picture in the middle, was her husband. So it was it was very symbolic, and it was a wonderful time for us to discuss the challenges and the changes that she was experiencing with the loss of her husband. Mr. S. Mr. S was from a European country, and he came to the home because he had had a stroke, and he had one-sided paralysis, and he had lost pretty much all of his language. Even to say yes or no, it tended to be grunts. So it was sometimes, I know that communication was a bit of a struggle with him, but his history, he had been a farmer in his country of origin. So he was always in the gardens outside, and he became involved in my programs. One of the things that I had him do, and actually on a side note, just let me backtrack, a really great activity is getting seed pods, different seed pods from flowers and vegetables, and having someone to, I guess, sort the seeds from the chaff, or separate the seeds. You can count them, put them in packages. So anyways, Mr. S, so one day I had him, we were working with different kinds of seeds, and what you see in that person's hand, that's actually portulaca. Portulaca is a Mexican flower. It's an annual here, very beautiful in dry, sunny areas of the garden. And look at the size of those seeds. In hindsight, I feel like I was rather cruel to him, but it was actually a really good activity in that he would roll the flower heads, now that they'd gone to seed, and the seeds would come out. So he was using his fine motor skills with this one hand that he was still able to use. And I would talk about the seeds and what we were doing. And so I remember making the comment, portulaca, what a name. Portulaca. Say that 3 times real fast. And he actually said Portulaca. My heart raced. I almost did a cartwheel. This man could barely say yes or no, and out comes out Portulaca, of all words. So I was quite excited, and he was excited, and one of the things, so we ended up actually getting a speech language therapist back into the home to work with him, and in our work with seeds, we would actually count together. So I would have larger seeds, and we would count out, say, 10 lily seeds, and we'd put them in a package, and he would actually do that. So that's just an example also of how horticultural based programming can assist with I guess regaining some abilities. And in finishing, I just want to also share one of my favorite quotes, because I really think that it's true that just living is not enough, said the butterfly. One must have sunshine, freedom, and a little flower. So thank you. And now we're going to see if anyone has any questions. Please feel free to type them in the question box. I think we might have something there. Just give me 1 second here. There's a comment. Yeah. So just a question around greenhouse, around perhaps an adult day program setting, perhaps at AOS. That would be an absolutely wonderful thing to have, and we'll see what we can do. And we'll just open up the chat box. Yeah, so it looks like we're good. If anybody does have questions afterwards, please feel free to get in contact with us. My email is kjohnson, with no T, kjohnson@alzheimeroutreach.org. Thank you very much for your time today, and please participate in future webinars with the Year of the Brain. Thank you. Take care.